Hi everyone, this is Heather, your instructor. This is my first demonstration video. I just bought this GoPro camera yesterday at the recommendation of one of my students, Savannah. Thank you, Savannah. I've just spent several hours learning how to use the camera, so this is not going to be great, but we're going to do it anyway. So you should have already watched the video that I uploaded in this particular tab on the training website. And so now we're just going to go through the same step-by-step process again, and it involves following the doctor's orders, preparing medications according to the what's called 8 rights of medication, and then following up for accuracy, so verifying all medications 3 times. So just like in the previous video, we're going to take a look at the actual doctor orders, and these are the same orders that we're going to use in class, and the same orders and these same documents are also available for download on the training website. So we're going to start off with metformin. So metformin is a medication for diabetes. So when you do your medication demonstration, it's called MedPass. That means that you're preparing medications to give to the client. You're going to be checking 3 times to make sure that each medication on the doctor order is transcribed accurately onto the MAR. It's called Medication Administration Record, called MAR. Then as you go along, as you prepare each medication, you're going to be double checking the label and making sure that the label, all the directions match on the MAR. You're going to document and sign and check one more time before you put everything back in the locked cabinet, because all medications have to be locked, and any medications that are controlled med or called Schedule 2, those actually get locked a second time. So we'll just go through. So in my mind, the role of the CRMA really comes down to 3 main overall tasks. You're going to follow the doctor orders here. You're going to follow the doctor orders. You are going to follow the 8 rights of safe medication administration. This is also available for download off my website. 8 rights of medication administration are: you've got the right patient or client, you've got the right medication, the right dose, the right route, meaning whether it's given by mouth or some other way, given at the right time for the right reason, keeping in mind that the client also has the right to refuse, and also following up with the right documentation. So I break it down, this part, the 8 rights of medication, I put it into a package of the 3-8-3 rule. So in addition to following these 8 rights to make sure you have each medication correct on all 8 of these points, you're also each time going to follow 3-8-3. So 3 things you're going to be avoiding distractions so that you can prepare your meds without being disturbed and interrupted to avoid mistakes. You're going to gather all your supplies ahead of time and always wash your hands. Wash your hands before every medication administration. Also, you're going to be checking every single medication that you give. You're going to be checking it 3 times. You're going to be verifying the doctor orders as you take the medications out of the cupboard or out of the lockbox. While you're preparing them, you're going to check the orders, the MAR again, to make sure it's all correct and the labels match. And then one last time before you put these medications away, you're going to check a 3rd time. So it's a lot. That's why you want to follow this step-by-step rule. So let's just go through. So we already verified all the orders to make sure that they all match on the MAR, transcribed correctly. Okay. Then the next step is we're going to take our medications out of the lockbox. Start off with metformin. Make sure the labels, everything, all the first 5 rights, really, on each label, you want to make sure you've got the first 5 rights accurate. Yes, okay. And then for each one, you're going to sign by putting your initial just got a phone call. We're going to keep going. So you're going to initial on the MAR, and that's your documentation to make sure that you've given the med. Okay, put that aside. Then you go on to the next med, aripiprazole. That is for depression. Any medication that is a psychotropic medication, meaning it falls in the classification of affecting mood and behavior, those orders are only good for 3 months, meaning for the most part, any medication that is ordered for mood or mood or behavior, the order will expire in 3 months. So you're checking again, at least the first 5 rights to make sure it matches the MAR. Yes, and you can sign your initial. All right. Now the next one. This one is a control medication. It's called methylphenidate or Concerta. This is a psychotropic med, but it also has a stimulant. That means that it really needs more control. It means more supervision and more closely monitoring of the client taking this medication. Orders for this control medication are also called Schedule II. Those orders expire in 30 days. So that's something to keep track of. When you're giving a medication that requires a second lock, it needs to be locked, double locked, actually. And the orders are only good for 30 days. Those also get documented in what's called a count book. And we're going to go through this in class more closely. It's really, this record is keeping track of how many pills are on hand, how many were given, and how many are left over. This is done every shift. All right, so we'll keep going. That gets back in double lock. The next one is ciprofloxacin. This is an antibiotic given for a urinary tract infection. Antibiotics can cause stomach upset, so clients may want to have something to eat first, maybe even just some crackers. Verifying at least the first 5 rights, the directions on the label, matching up well with the MAR, and you sign that you gave it, that you're going to give it. And then, let's see, the next one, metoprolol. This is a heart medication for hypertension. The orders for this one say that we need to check the pulse before we give it. We would not want to give a medication to lower someone's heart rate if the heart rate is already low to begin with, because then the person can become unresponsive and then you have an emergency on your hands. So with this medication, you need to check the pulse. Generally, that pulse is ordered to be taken apical, meaning at the heart. We're going to demonstrate that in class, and the pulse needs to be checked for a full minute. As long as the pulse is above 60, it's okay to give the medication. If the pulse were below 60, like if it were 55, let's say, you'd want to check it again to make sure you had it accurate. You want to be looking at the client overall. Are they, do they seem weak and tired? Or they seem confused? You want to see if they're really normal or abnormal. If they're abnormal and you're getting a low pulse, that's going to be a call to the doctor. Anytime you don't give a medication for any reason, you're going to be documenting on the back of the MAR. And it's going to ask for an explanation. I gave some examples here.